If you have a bunion and want to avoid surgery, make sure you check out this video. I'm going to give you a great option. If you have a bunion, have bunions in the family, or worried that your only option is surgical intervention. So my name is Daniel from Sydney Foot Solutions. We see over 100 bunions a week. We usually can successfully treat them via conservative management approaches. So make sure you watch this video. I'm going to go into how we treated it, a successful case study, and I'll even show you before and after x-rays that prove that we can help straighten and improve the alignment of a bunion and do it so that it's long-term and it's hugely beneficial from a long-term function perspective. As I mentioned, we see lots and lots of bunions and we see lots of similarities with those bunions. In fact, we see well over 100 bunions a week. And to put it in perspective, 1 in 3 people has a bunion, quite frankly. So it's a pretty big market. Of those people that have a bunion, what I hear all the time is, I didn't realize you could treat a bunion without surgery. And the great thing is you can. And so it's not that surgeons don't do a great job. It's just that surgeons mainly treat extreme cases. So the reason we started seeing so many bunions over 20 years ago is because people thought that their only option was just to wait for their bunion to get so bad that they went down the road of the surgical intervention. And nothing against surgery, but let's face it, surgery is very traumatic. It's 6 to 8 weeks off your feet, and it costs about $8,000 a foot. So the reality is that all of those things combined, it's a fairly significant cost, both time, money, effort, and in pain. And let's face it, surgery is trauma, as a surgeon has told me. So if you can avoid it, why wouldn't you? So you might say, how do you treat a bunion? The way we do treat a bunion is just through a very gentle hands-on technique where we work on correcting that level of alignment within a bunion. And then we give you exercises to support those changes so that we improve the function long-term and start to improve the alignment of your big toe so we start to straighten that back up. I want to take you through a case study which will help explain that process in a little bit more depth. We had a wonderful patient attend our clinic in the last 3 months. She was a mother of 2 and she was a local school teacher and she was struggling with bunion and bunion pain. And she was really worried. She could put up with it, but she was really worried that in many respects, she was just going to have to wait until she needed the bunion surgery. As you can imagine, this is a fairly significant concern in the respect that she's on her feet for work. So she couldn't afford the 6 to 8 weeks off her feet. So she's on her feet for work as a teacher, not to mention the recovery time would be fairly significant if you're on your feet quite a lot. Also, if she's a busy mum, she doesn't have time for surgery, not to mention the upwards of $7,000 in surgeon's fees is a fair hit, particularly for a mum and a young family. Needless to say, we only charge a fraction of that. And so she came to us. She had seen some of our advertising and was definitely keen to consider what we did. So she came in for an initial assessment. We sent for a weight-bearing x-ray just so we can double check everything and measure and then come up with the best course of action. She started the course of treatment and we treated her over a 3-month cycle of treatment. When she came in, it was a gentle hands-on technique and we combined that with exercise therapy. And then we also hit her with our fencing. But the benefit of the laser therapy is that it reduces inflammatory response, it reduces pain, and improves the outcomes long term. She went for a follow-up x-ray to compare the changes within her before and afters, and she had a great result, much, much more than we were expecting. Normally, when we treat a bunion, we expect a change of about 4 to 6 degrees. But in her particular instance, when we first started, the ideal reading for a bunion should be between 10 and 15 degrees. That's technically an anatomically straight toe. And she was 41 degrees if you round up. And then she's now down to 21 degrees. So I'm going to shoot to this slide so you can see it in more detail. I just wanted to give you some idea. And she had a great result on both feet, but I'm picking one foot just to go through this so you can see it. So needless to say, with minimal involvement for us, she should get better. Her function long-term should improve. And I guess that's one of the huge advantages. If you can avoid the surgical intervention is traumatic to your feet. It will interfere with the surgery and then they put a big pin through your foot as well. So if you can avoid that, it's definitely preferable in terms of long-term function. If you do have a bunion and you want to look into it further, make sure you check out the link below with our 60% off initial bunion assessment, where you can get individualized advice on your bunion for just $40. And here is the before and after shots before and after our bunion treatment for this particular patient. So just to recap, this particular patient was a busy mum who's a teacher in the area. She just could not afford to consider the surgical intervention. What we can see through here is that she's got a bunion of around about 40, just under 41 degrees, which is fairly significant. The underlying cause down here, we can see that she has a very highly pronated foot type where she rolls in. And so this is the before shot over here on the left, even though it's the right side. So it says right wet breed just through here. And then what we can see is how much straighter this toe is on this side. So just to summarize, the ideal reading for a big toe should be between 10 and 15 degrees. Anything over 30 is reasonably extreme. And we've taken her from 41 to roughly 21 degrees. So we can see that there's been a significant straightening. You tell through here. There's been a reduction within the forefoot, so it's actually reduced width. And we can see that there's a significant improvement in the pronation through the rear of the foot and also through the midfoot as well. Needless to say, this particular patient was really happy with her treatment outcome. And we're absolutely thrilled that we are able to help people avoid the need for surgical intervention, particularly when you don't have the option of considering the surgical intervention, both from a practical perspective, as in you can't afford to have 6 to 8 weeks off your feet. The financial perspective, given up that bunion surgery is upwards of $7,500 a foot in many instances. And also, let's face it, it's just not practical and you don't end up with a functional foot because often they do need to pin these areas. So what we would encourage people though is that this is a really favourable result, but you want to get on top of this sooner rather than later. So please take that into account. And we'd strongly encourage that if you have a bunion, that you take us up on our 60% off initial bunion assessment offer. The reason we do it is so that we can give you individualized advice and help you avoid surgery long term. We also make sure, if you like this video, I hope it was helpful, please the video and also subscribe to our channel. We try and produce lots of helpful content so that we can help people with their foot health long term. I hope this has helped and thank you very much for watching.